والصلاة والسلام على سيدنا محمد أشرف المرسلين. أبنائي الأحباء طلبة كلية طب الأسنان جامعة الأنطرة، كل سنة وانتم طيبين. في لقاء آخر ومحاضرة أخرى about radiation and radiotherapy for clinical removable prosthodontic 4. معاكم الدكتورة إيمان عبد السلام شكل، أستاذ ورئيس قسم الاستعاضة بطب الأسنان جامعة الأنطرة. Radiation and radiotherapy prosthesis. The common treatment of neoplasm is surgery and or radiation. A tumor can be destroyed radiation if the dose is sufficient and is within the tolerance level of the adjacent normal tissue. Post-radiation sequelae are significant and may result in total morbidity. Now, the effects of radiation. Primary effects of radiation occur within the nucleus since it is 100 to 1000 times more sensitive to radiation than the cytoplasm. Now, the effects of radiation on oral and paraoral tissues. We have immediate effect and delayed effect. Immediate, there is the effect on the oral mucous membrane, immediate effects on skin, tongue and lips, eyes. Delayed effect will be demonstrated in salivary gland, teeth and periodontium, diet, bone, eyes, tongue and mucosa, skin and trismus. Radiotherapy prostheses are stents used to help the radiotherapist in treatment of oral malignancy by radiation. The objective here for radiotherapy prostheses is to reduce the side effect of the treatment by radiation on the healthy normal tissue. It has the effect on the tumor tissue, but we must reduce the side effect of radiation on the healthy tissue. It protects tissue that are not meant to receive radiation. It increases the accuracy of radiation source and assures that the area of treatment is the same every time the patient is irradiated. It results in a more cooperative patient since discomfort and injuries are reduced. These are the objectives of radiotherapy prostheses. Now, what are the requirements? Comfort, retention and stability, easy to repair and clean, minimal weight, suitable strength, allow visualization of the. Now, the types of radiotherapy prostheses. We have fluoride tray named fluoride stent. Radiation-induced xerostomia increases the incidence of radiation carriers. Topical application of fluorides is begun immediately, which dramatically reduces the incidence of caries. It also minimizes localized mucositis occurred due to scattered radiation from metallic dental restorations in the mouth. The second type of radiotherapy prosthesis is positioning stent or prosthesis to display the tissues. This type of stent used to place the diseased tissue, tongue and floor of the mouth within the radiation field and normal tissues away. It consists of an interocclusal stent that extends lingually, vertical wall lingual to the lower teeth, gingiva, and lingual mucosa, with a flat acrylic resin to depress the tongue within the lower border of the mandible. A hole is made anteriorly in which the tongue is placed to establish a reproducible position. The third type of the radiotherapy stent is a perioral cone positioning device or beam director. This stent is used to orient the preoral cone in a repeatable position during therapy. It is used in the treatment of smaller superficial lesions such as anterior floor of the mouth, hard palate, soft palate, or tongue. Now the construction of this stent. First, maxillary and mandibular casts are obtained and mounted at an open vertical dimension of occlusion. An acrylic resin tube is fashioned that will accept the preoral cone. This tube should be at least 6 cm in length and ensure stability of the cone. The tube is then positioned over the tumor site and attached to acrylic resin record bases in case of edentulous patients or to occlusal index for dentate patients with self-curing resin. Number 4. Positioning radioactive source or carrier. It is used to administer pre-calculated dose of radiation to relatively inaccessible area. They help in direction of the radiation to the exact location. The base position portion of the carrier is constructed on the cast either in self-curing acrylic resin or heat-curing resin. Radioactive material may be embedded in the fitting surface at the required areas, or a metal wire carrying radium capsule at one end and attached to the base at the other end. Now, shielding or tongue protector. This type of stent is helpful for protection when a patient is to receive a unilateral dose of radiation. For example, tumor in the mandibular gingiva, mucosa, or skin. The stent is designed to display the tongue away from the treatment area by the vertical wall extending downward lingual, the mandibular teeth, and the mucosa. Also, the stent opens the vertical dimension of occlusion by vertical wall extending upward buccally to the maxillary teeth. So the field of radiation would not involve as much of the parotid gland. Here, the prosthetic evaluation and the management in case of irradiated patients that take radiation and you want to do prosthesis, how you can manage these cases. Timing of placement of denture. The construction of dentures for irradiated patients should be made after 12 to 14 months for mucosal healing. Some patients must wait 2 to 3 years before the mucosa has recovered sufficiently for dentures to be tolerated. Now, the prosthodontic procedures for complete dentures. Success of prosthodontic treatment depends on: number 1, preoperative data, thorough oral examination, a non-traumatic and non-irritating denture, and effective follow-up system. In case of preoperative data, information collected from therapists should include the type and site of the tumor, the mode of the therapy employed, total dose, data of treatment, radiation field, tumor response, and the prognosis of the disease. Oral examination. When doing oral examination, include appearance of the oral mucous membrane, scarring and fibrosis at the tumor size, degree of trismus, and status of salivary gland function. The amount and viscosity of saliva is an important determinant of prosthodontic success. The denture foundation should be examined for undercuts, tori, high tissue attachment, enlarged maxillary tuberosity, flabby tissue, and abnormal jaw relations. Necrosis may take place in the area of undesirable undercut if it is lie within the field of irradiation during insertion and removal of the dentures. The trauma resulting from the surgical removal of these undercuts could also cause necrosis. The entire oral cavity should be examined visually and palpated for any soreness. Now, the prosthodontic procedures. It is essential that all oral procedures necessary in constructing the denture be carried out with as little trauma and irritation to the oral mucosa as possible. Number 1, impression. Primary impressions should be made using irreversible hydrocolloid rather than thermoplastic materials, which may result in tissue irritation. Conventional border molding using low-fusing wax or modeling plastic resin or heavy body rubber base should be performed with care to avoid overextension, particularly lingually, because overextension could result in a mucosal perforation. The mylohyoid area is a critical spot on which to avoid excessive pressure. Final impression is made in rubber-based material. Now, zinc oxide eugenol material and impression plasters are contraindicated because of their irritating effect. Because here the zinc oxide irritation of the eugenol. The plaster impression material, this is because there is no, the plaster wanted to absorb the saliva, and here is the problem in saliva because of the effect of the radiation on the salivary gland. Jaw relation, reducing the vertical dimension may limit the extent of the force applied to the supporting mucosa and bone during the forceful closure. Also, patients with clinically significant trismus increasing the interocclusal space will make it easier for the entrance of bolus of food. Wax, plaster, zinc oxide paste are suitable interocclusal media during centric relation registration. Now, for the selection and the setting up of teeth, selection of both anatomic teeth with proper balance and non-anatomic form could be employed. Monoplane is more favorable because less horizontal force is generated. Occlusal trauma may lead to soft tissue necrosis. هنا احنا بنلجأ إلى acrylic teeth monoplane 0-degree teeth angle is preferred. If you want to take anatomical teeth or 30 اللي هي الانجلز بتاعتها من 30 ل 33 انجلز، في الحالة دي لازم ensure يبقى فيه proper balance occlusion to avoid occlusal trauma that will lead to soft tissue damage, necrosis. Number 4, try-in. The waxed denture is tried in the patient's mouth and the denture base should be cut away in the irradiation region if possible, without gently sacrificing the stability of the finished prosthesis. Soft liner. Silicone liners have been suggested as a mean for minimizing mucosal trauma in mandibular denture. It is preferred for lining the mandibular denture. Denture insertion. Any rough projection in the fitting surface should be smoothed, and light polishing on the fitting surface of the denture is advisable. Pressure indicator paste is used to identify areas of excessive pressure and disclosing wax is useful in delimited overextension of the denture flanges. Remounting and occlusal adjustment are essential. Now, strict oral hygiene is recommended for good oral hygiene for the patients. Follow-up: patients should be seen daily for 2 weeks after completion of the dentures, every 3 months thereafter. Any slight discomfort should be considered with concern without delay. أي مشكلة لازم نحن نشوفها، ما نقدرش نعمل لها delay علشان الخوف هنا على الأورال ميوكوزا وعلى البون وعلى الميوكوبروسيوم، على إذا كان في سنان متبقية. لو أنت بتركبي بارشل أو حاجة لازم إن احنا ناخد بعناية وبتركيز أي كومبلين للمريض يقوله. Cooperation of the patients is necessary to reduce and unnecessary complications such as bone or soft tissue necrosis. لازم يبقى في تعاون من المريض عشان نقلل ال unnecessary complication على البون والsoft. Thank you. For any questions, you feel free to contact me, Professor Dr. إيمان عبد السلام شكل. أبنائي الأحباء، أتمنى لكم كل التوفيق. هذه الباوربوينت بالفويس ريكورد هتقدر تساعدكم مع الهاند اوت اللي أنا سايبها لكم إن شاء الله. تبقى حاجة مفيدة لكم. ولو في أي سؤال أي discussion feel free to contact me at any time. Thank you and السلام عليكم ورحمة الله.